Now, if one or both ovaries are conserved at the time of a hysterectomy, there are 3 possible scenarios that can happen. Number 1, you can have continued normal function of the ovaries. Now, the ovaries may continue producing their hormones in their usual manner until the normal age of menopause, usually the age of about 51 or 52. However, if you have no periods, you can still have PMS or PMDD, premenstrual dysphoric disorder, because the hormones produced by the ovaries that are left behind still work on a cyclical basis, even though you don't have periods to show for it. Number 2, early ovarian insufficiency apparent. Following a hysterectomy, the ovaries may stop producing hormones sooner than you may expect it to. Now, this may mean that you go into an earlier than usual menopause, and that could happen to anyone. This is mostly due to the disturbance of the blood supply that are going to the ovaries. So if I show you that the blood supply that affects this can also be damaged or affected whilst the hysterectomy was happening. So essentially, the ovaries can literally pack up either immediately after surgery or after a number of years later. So if that happens, menopausal symptoms can occur because then you're having lowering estrogen. So you could have hot flushes, night sweats, brain fog, low mood, irritability, anger, rage, sleep disturbances, low libido, weight gain that you don't want, vaginal dryness, irritable bladder, urinary tract infections. There was over 42 different types of symptoms that are related to the menopause. If these are the symptoms that you're experiencing, even if your ovaries are left behind, it's important you go and speak to your doctor to think about hormone replacement therapy. And it's important that we think about getting early detection of ovarian insufficiency dealt with, because estrogen deficiency symptoms can be debilitating and affect you and your livelihood and also how you're feeling. B, estrogen is vital for maintaining bone health. So the production of estrogen, if it's lost before the age of 45, so you go through an early menopause, then you've got an increased risk of osteoporosis or bone thinning. And then C, estrogen also protects the heart and blood vessels. So losing estrogen production, particularly before the age of 45, can increase the risk of cardiovascular disease. Then number 3, the third group of women, early ovarian insufficiency, but the silent type. In some women, the conservation of the ovaries may fail earlier than usual, but the falling estrogen levels do not always become noticeable and also cause menopausal symptoms. Therefore, it's suggested that following a hysterectomy with one or both ovaries conserved before the age of 45, a blood test can be taken approximately once per year to check if any silent menopause has concerned, particularly if there are no menopausal symptoms that are developing. If there are any menopausal symptoms, such as hot flushes or night sweats, then obviously a blood test is not needed.